All right, today we are diving into something that honestly sounds like it's straight out of science fiction: healing bone with sound. And no, it's not magic, it's a seriously powerful medical tool that's changing the game. So let's just get right to it. The big question: can you really heal bone with sound waves? It seems pretty wild, I know, but the answer could completely revolutionize how we treat some of the most stubborn and painful joint problems out there. But, before we can really appreciate the solution, we have to understand the problem. And the problem here is this mysterious condition that causes a deep, nagging ache right inside our joints. It's called bone marrow edema, or BME for short. Now, the easiest way to picture this is to think of a bruise, but a bruise that's deep inside your bone. Fluid builds up, it creates pressure, and that causes this intense pain that just will not go away. And we're not talking about some minor ache here. This is a relentless, deep pain in major joints like your hip or your knee. And what's so frustrating is that recovery is just painfully slow. We're talking anywhere from 3 months to a year and a half. And get this, while it can affect young women, it's actually 3 times more likely to happen to middle-aged men.
So how have we been dealing with this up until now? Well, the old playbook, unfortunately, doesn't have a lot of great options.
On the one hand, you've got what they call conservative care, which is basically painkillers and rest. And yeah, that might take the edge off the pain, but it does absolutely nothing to make you heal any faster. The other option? Surgery. A procedure where they literally drill holes into your bone to relieve the pressure. It is super invasive, and it comes with some scary risks, like infection or even fracturing the very bone they're trying to fix. So you can see why doctors were desperate for a better, safer alternative. And that brings us to the hero of our story today, a non-invasive technology that uses, you guessed it, sound waves. It's called Extracorporeal Shock Wave Therapy, or let's just call it ESWT. The whole idea is pretty genius. You use these focused, high-energy sound waves from outside the body to basically wake up and supercharge your body's own natural healing abilities deep inside the bone. So how on earth does it work? Well, think of it like a three-pronged attack on the injury. First, the sound waves jolt the osteoblasts. Those are your body's little construction workers that build new bone. Second, they boost blood flow by encouraging new blood vessels to grow, bringing in all the good stuff like oxygen and nutrients. And finally, they trigger the release of stem cells and growth factors, basically sounding the 5-alarm fire bell for your body's repair crew to get to work. Okay, that all sounds amazing in theory, but the real question is, does it actually work in the real world? Well, to find out, researchers decided to put the evidence on trial. And they didn't just look at 1 or 2 studies. No, they did a massive review, which is kind of like the Supreme Court of scientific evidence. They took all the data from 16 different clinical trials and pooled it all together to get the clearest, most reliable answer possible. Now, this chart might look a little intense, but the takeaway is actually super simple. It's called a forest plot. Each of those horizontal lines is a different study. But the most important part is that black diamond at the bottom. Since it's sitting way over to the left of that center line, it means the evidence is overwhelming. Shockwave therapy works. But let's break that down into something a little easier to see. Because when it came to knocking out pain, the results were, well, they were pretty incredible. And here is the bottom line. After just 1 month, patients getting the standard treatment still rated their pain at almost a 5 out of 10. But the group that got the shockwave therapy, their pain plummeted to just 2.6. I mean, that is a huge difference in only 4 weeks. And look, this wasn't just about numbers on a pain chart. This was about people getting their lives back. Patients who were treated with shockwave therapy could move better, and they could get back to their normal daily lives way faster. And sure enough, when we look at the data for physical function, just being able to move around, we see the exact same story. Here's another one of those forest plots, and once again, that black diamond at the bottom shows a powerful, undeniable benefit for the shockwave therapy group. But what about physical proof? Could they actually see the healing happening? Oh yeah. Look at this table with the results from MRI scans. In one study, 90% of the shockwave patients had visible improvement after 3 months, compared to just 61% of the others. In another, it was 88% versus only 41%. The images don't lie. The sound was literally healing the bone. Of course, with any new treatment, you gotta ask the big question: is it safe? And this is where the news just gets better. Across all 16 of those studies, there were 0, that's right, 0 major bad side effects reported. The only things people mentioned were minor things, like a little temporary bruising. I mean, that is a world away from the risks of major surgery. So when you put all of this evidence together, what does it all mean? Well, it forces us to ask a really important question. Could this be the new standard of care? I mean, just look at the comparison when you put ESWT and surgery side by side. It is stark. One is non-invasive, has fewer complications, costs less, and gets you back to your life faster. The other is the exact opposite. And this whole idea, healing the body from the outside in without ever making a single cut, that's the holy grail of modern medicine. The choice here seems pretty darn clear. And hey, don't just take my word for it. This is the final verdict, right from the scientists who did the research. They call it a promising therapeutic approach that could serve as a direct alternative to surgical treatment. You know, in the world of science, that is about as strong an endorsement as you can get. So, that leaves us with one final huge thought. This research was about one specific condition, right? But the implications, they're so much bigger. If we can safely and effectively heal bone deep inside the body just by using sound, what else could we heal? Could this be the beginning of a whole new era in how we treat chronic joint pain for good?